From Los Angeles, California, to the greater world beyond, we face countless environmental and health issues, such as air pollution, toxic contamination in both land and products, climate change from environmental degradation, and nuclear threats, now as much as ever. We at PSR-LA believe in the power of advocacy and the voices of health professionals to create solutions to these complex issues. Let us hear some of these voices and see what happens when physicians step outside the clinic.
I am a physician, and my role in both health advocacy and with Physicians for Social Responsibility, I'm a family doctor, and I consider my greatest role is that of health education, awareness, and prevention. And I actually look at my work with PSR as an extension therein. I call it, and frequently refer to it as a prescription for survival, survival for the planet.
As a family physician, family is important, and extending the concept of family to the community, whether it be the local community or the global community, is important. And I am an educator too. I'm a family medicine residency director. I'm a professor at both UCLA and the Charles Drew University College of Medicine.
I believe I first heard of PSR-LA when I met Marta. And that was through work on reproductive health and the environment, through my work in the Department of Public Health. Currently, I am the Sexually Transmitted Disease Controller for LA County, and that's in the Division of HIV and STD Programs with the Los Angeles County Department of Public Health.
So basically my role in health advocacy with PSR is to educate others, to educate the public and educate politicians about the health impacts of climate change and air pollution.
I am Japanese American, born in a relocation camp for Japanese Americans, and Japan is the only country that suffered the dropping of 2 atomic bombs on Hiroshima and Nagasaki. So I've been involved with the anti-nuclear movement as long as I can remember.
We know as physicians that there is no reasonable medical response to an atomic blast or an atomic bomb should it ever go off. No reasonable approach or response. That being the case, as it is analogous to any dramatic and major public health risks, our role is to prevent what we cannot cure.
It's really important as an advocate to be able to step outside the 4 walls of your clinic or your office and learn about the environment around you, the politics around you, the policies especially, the laws and regulations around you, so that you can shape what's going on with your patients for the 99.9% of their time when they live outside of your clinic or your office, because there are policies happening that are severely impacting their lives.
So my background is in pathology, and I know how toxins and pollutants affect human tissues and organs. It's very important for me to share this knowledge with the communities because when doctors actually directly work with communities, it's more likely to result in long-term changes.
In the words of Albert Schweitzer, make your life your argument. So the issues that are important to you, that you're passionate about, I think it's important that you dedicate your life to trying to remediate the issues and to advance the health of whatever community you reside in.
So I think as part of medicine, it is our job. As part of public health, it is our role to engage in the greater social issues and make change and force our policymakers to make changes that benefit our communities through the advancement of socially responsive policies.
There's such a need in public health for people to take leadership roles and speak out, and that's what PSR does, and I'm just so proud of what they've done, and I keep going because they keep going.
I would encourage any physician or health practitioner or ultimately anyone who's interested or ever given thought to these difficult and challenging issues to join us. So oftentimes we get frustrated and think, well, how can I make a difference? But ultimately, it's my true feeling that only individuals working together will make a difference and will ultimately move this planet to where we need to be. So I encourage each and every one to join us. We look forward to working together.